So I think as we speak now, so I think the most convincing data I have seen in the recent times has been with NK cells. And on the one hand, especially in the context of engineering NK cells, I think this data have been quite exciting. Although the call for caution is, of course, that these are still early phase trials with a low number of patients. Essentially, really one center or very few center doing these studies, and so essentially they called for larger validation and also confirmation, maybe also across centers, but also across entities. But clearly that's a very exciting and very promising field to me, and I think to many others as well. And I think we may be also able to trigger similar things with proteins, so meaning with bispecific or other approaches that are targeting NK cells and maybe going into the direction. And again, so there've been some, well, at least encouraging phase 1 clinical trials. I think one of those that were mentioned is the CD16, CD30 bispecific antibody, which is recruiting NK cells to certain types of lymphoma that are CD30 positive, that showed some promise. But again, so it's a phase 1 trial in really refractory patients. So again, it's to be taken with caution. And again, so I think this CD47 data is also quite encouraging, although it also shows that applying a new concept into patients is not a self runner. So probably, and that's, to me, that's also one of the big topics in immuno-oncology these days, is that actually we need really to get off this one-fits-all approach type that we have been all practicing, especially also pharma loves to practice because it's more attractive and less complicated. But the truth is, I think we've lost a lot of great concepts along the way just because we were not patient enough to narrow it down to the actual patients that are to benefit from it. And I think going forward with the resources that are more and more limited in the field, and I think this will become, or is, if it's not already, and to me it's already a big question that needs to be solved, is how do we refine all these approaches to the ones that are most likely to benefit from. And I think this is something that to me will need to be really incorporated in the preclinical work and the trial design in the future, so that we won't be wasting resources on, or less resources at least, on concepts that are simply not promising because they're just hitting the wrong patients.